Hello, I'm Dr. Gregory Davis, gynecologist in Chico, California. Thank you for joining me. We're going to talk about in this episode on the Mirena IUD some of the problems related to the Mirena IUD. If you Google problems related to the Mirena, there's going to be a whole host of complications. I can tell you that most all of the complications come about from trouble putting the IUD in. Now, when you look at how we put the IUD in, you notice that the IUD, the applicator, is curved. Well, most ladies' uterus is going to be in a position where it's just tilted in a normal position. But some ladies' uterus is tilted way back, some are tilted way forward. Now, if your provider is not able to tell that, and they don't know if your uterus is tilted back and is tilting back this way, and they put this in this way, it can perforate. So most of the complications occur from putting in the IUD. So in our office, to prevent complications, every patient that gets an IUD has an ultrasound done so that I know which way the uterus is before I put it in. It's kind of like looking at a map before you take a trip. The other thing is we use a local anesthetic. We use an alpha stim, which is a little instrument we put on your ear that kind of helps your pain threshold to increase, and so that you don't have as much cramping. I try to make it to where you have no pain, because if you have pain, then it makes it more difficult to put the IUD in. So if you're going to have an IUD put in, I would recommend that you go to a provider that's going to be able to do an ultrasound, provide you with some local anesthetic, and try to make it as easy as possible of putting that in. Thank you for joining me today.